Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Antineoplastic medications. Chemotherapy dosing is usually based on the total body surface. What should the nurse do before administering chemotherapy? Option A. Get the body mass index, BMI. Option B. Ask the client about intake and output. Option C. Weigh and measure the height of the patient on the day of administration. Option D. Ask the client for the height and weight. Right answer is Option C. Weigh and measure the height of the patient on the day of administration. To assure that the client obtains optimal doses of chemotherapy, dosing is usually based on the total body surface, BSA, which requires an accurate current measurement of height and weight on the day of the administration. Options A and B will not provide the information needed. Option D will lead to inaccurate value in determining the true body total surface. The nurse is caring for a client who is receiving a chemotherapy. Which of the following would be expected as a result of the massive cell destruction that occurred from the chemotherapy? Option A. Leukopenia. Option B. Anemia. Option C. Thrombocytopenia. Option D. Hyperuricemia. Right answer is Option D. Hyperuricemia. Increased level of uric acid, hyperuricemia, in the body is common following the treatment for leukemias and lymphomas because chemotherapy results in massive cell destruction. Options A, B, and C are usually noted, but an increased uric acid level is specifically related to massive cell destruction. Mitomycin, mutomycin, is prescribed to a client with colorectal cancer, all of which are the routes of administration, except Option A, oral. Option B, intravenous. Option C, intravesical. Option D, intra-arterial. Right answer is Option A, oral. Mitomycin, mutomycin, is an anti-tumor antibiotic used in the treatment of anal, bladder, breast, cervical, colorectal, head and neck, and non-small cell lung cancer. There is no pill form of this medication. Options B, C, and D are the routes of medication. The client with a testicular cancer is being treated with Etoposide, Etopophos. Which of the following side effect is specifically associated with this medication? Option A, chest pain. Option B, edema. Option C, alopecia. Option D, orthostatic hypotension. Right answer is Option D, orthostatic hypotension. While on Etoposide infusion, blood pressure is monitored throughout and it should be administered slowly over 30 to 60 minutes to avoid hypotension. Options A and B are not related to this medication. Option C, alopecia happens nearly with all the neoplastic medications. The clinic nurse provides instructions to a client receiving an antineoplastic medication. When implementing the plan, the nurse tells the client to Option A, to drink beverages containing alcohol in moderate amount during the evening. Option B, to eat high-fiber rich foods. Option C, to take acetylsalicylic acid as needed for headache. Option D, to consult with healthcare providers before receiving immunization. Right answer is Option D, to consult with healthcare providers before receiving immunization. Because antineoplastic medications lower the resistance of the body, clients must be informed not to receive immunizations without a healthcare provider's approval. Option A, clients need to avoid alcohol to minimize the risk of toxicity. Option B, diarrhea as one of the common signs of antineoplastic medication needs to avoid spicy and high-fiber foods which can increase peristalsis. Option C, clients need to avoid aspirin to minimize the risk of bleeding. The client with non-Hodgkin's lymphoma is being managed with vincristine, Vincasar. Which of the following indicates a side effect specific to this medication? Option A. Alopecia. Option B. Numbness in the toes. Option C. Chest heaviness. Option D. Weight gain. Right answer is option B. Numbness in the toes. A side effect specific to this medication is peripheral neuropathy. It can be manifested as numbness and tingling sensation in the finger and toes. Option A. Alopecia occurs nearly with all the neoplastic medications. Option C and D are not related to this medication. A client with a sarcoma is receiving Bleomycin, Blenoxane. The nurse in charge with the client expect the physician to order which diagnostic procedure? Option A. Pulmonary function studies, PFTs. Option B. Stress test. Option C. Cranial X-ray. Option D. Electrocardiogram, ECG. Right answer is option A. Pulmonary function studies, PFTs. Bleomycin, Blenoxane, is an anti-tumor antibiotic that can cause interstitial pulmonary fibrosis. Pulmonary function tests and chest X-ray are done while on this treatment. Options B, C, and D are not related to the specific use of this medication. A male client with breast cancer is receiving tamoxifen, Nolvadex. The nurse specifically monitors which laboratory value? Option A. Activated partial thromboplastin time. Option B. Triglyceride level. Option C. Fasting blood sugar. Option D. Serum sodium and potassium. Right answer is option B. Triglyceride level. Tamoxifen, Nolvadex, is an antineoplastic medication that may increase cholesterol, triglyceride and calcium levels. Complete blood count, platelet count, serum calcium, cholesterol, and triglyceride level must be monitored periodically before the administration of this medication. Megestrol acetate, Megace, is prescribed for a client with advanced breast cancer. The nurse reviews the client's history and contacts the physician if which of the following is documented in the client's history. Option A. Pulmonary embolism. Option B. Gouty arthritis. Option C. Bronchial asthma. Option D. Ischemic heart disease. Right answer is option A. Pulmonary embolism. Megestrol acetate, Megace, is an antineoplastic agent that treats breast and endometrial cancer. This medication is contraindicated for patients with a history of thrombophlebitis and pulmonary embolism. Options B, C, and D are not contraindicated with this medication. The nurse is monitoring the laboratory results of a male client receiving antineoplastic medications. The nurse plans to initiate bleeding precautions if which laboratory's value is noted. Option A. White blood cell count of 6,000/3. Option B. Platelet count of 45,000 cells/3. Option C. Clotting time of 8 minutes. Option D. Hemoglobin count of 15 grams/dl. Right answer is option B. Platelet count of 45,000 cells/3. The normal value for platelet is 1,50,000 to 4,50,000 cells/3. When platelet count is less than 50,000 cells/3, minor trauma can lead to episodes of prolonged bleeding. When less than 20,000 cells/3, spontaneous and uncontrolled bleeding can occur. Option A. Normal white blood cell count is 4,000 to 11,000/3. Option C. Normal clotting time is 8 to 15 minutes. Option D. Normal HGB is 13.5 to 17.5 grams/dl. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.